Okay, I think we'll just crack on with that. Just before we start, just to let you know, Q&A is open on this. So if you have any questions, pop them in there or in the chat. Okay, so thanks for joining. This is my talk on cybersecurity awareness in healthcare. So who am I? I'm Stuart Kuratach. I've worked in IT for about 13 years. I've been at NCC Group for nearly 6 years now, and 4 of those as a security consultant. Over the past 3 years, a good portion of my time has been devoted to research in connected health. I'm part of a small core team, but at NCC we've got access to global resources as well as specialist teams, including hardware and risk management. So today it's going to be pretty high level. I'm going to be talking about a few things, so there's not much technical content in there, and that anything technical is fairly simple. I'm going to talk about the transformation of healthcare as it moves away from paper-based systems, and also about medical devices, how they've evolved, becoming more connected. I'll then touch on the security landscape as those devices have become more connected, and how has changed how IT teams and the issues they face with that. I'll then briefly touch on patient data privacy as we talk about how big tech has become more involved in the prevalence of health apps. And then towards the end, there's a list of real world problems that I've looked at and discovered over the past few years from various articles covering a broad range of areas. And then at the end, any questions? Okay. So, healthcare industry has been undergoing a digital transformation for many years now. In some cases, it's been pretty slow, but that's at least partially due down to technology needing to be thoroughly tested and proven before it's entrusted with a patient's well-being. There's legacy systems, so there's still a lot of paper-based systems out there, as well as reliance on faxes and pages. And although these are being phased out, so you may have heard of terms such as axe the fax and purge the pager. However, things like pages are still reliable from a medical professional perspective. However, they're not efficient, and they've been shown on a number of occasions just how insecure they are, as transmissions are encoded and not encrypted. So encoded is easily reversed into the original text, whereas encrypted shouldn't be. A major part of that transformation is the EHR, electronic health record. So there's also EMR and EPR, which is electronic medical record or electronic patient record. It's basically a digital record of a person's medical history. So, for example, when you go to visit a GP, you may see them typing into a computer, and that's generally got to be into an EHR. So these systems contain a lot of PHI, or protected health information, which is valuable data to cyber criminals. We've also got medical devices. Now these are that's a broad term, but for the purpose of this talk, I'll just be using it to refer to electronic devices that have some form of underlying software. So medical device manufacturers over the years have increased the feature set, and part of the capabilities that they introduce is sort of a network connectivity. So that can be either through plugging in from a cable or wireless or Bluetooth or whichever is required. So you imagine sort of the benefits of these could be, so a vital signs monitor that gets the data gets sent to a nurse's station, so that they can monitor those vitals continuously instead of only as and when they go around checking each bed in a ward. So although these features obviously have clear benefits, they also increase the number of ways an attacker could potentially compromise a device, or either directly or as a foothold within a network to further compromise that network. Cloud services. So a transition to the cloud has is everywhere, not just in healthcare. The UK had introduced a policy in 2013, which was a cloud first policy that's sort of been changed to when cloud is like the best option. So companies like Google, AWS, and Microsoft, they're offering cloud services in line with healthcare. So they're offering things like that are GDPR compliant or HIPAA. So HIPAA is the Health Insurance Portability and Accountability Act, which is the governing regulation in the US for healthcare services. So the thing to remember about cloud infrastructure is that it can often be left configured insecurely. This might be to do with the fact that this is deemed as a third party dealing with it as opposed to the organization. There's plenty of instances where we've seen sort of data repositories left open on the internet without any form of authentication protecting it. And finally, on this slide, we've got telehealth. So telehealth has been bubbling under for some time prior to the pandemic. There was a lack of adoption, as it seemed pretty complicated to implement and potentially wouldn't give the level of care required. However, so due to the pandemic, there's little choice in adoption now. So, and it showed in most cases that it's been received positively and allows access to care for vulnerable or isolated. So, yeah, when we look at the cybersecurity landscape, when you look at the healthcare sector in particular, it's complex, which generally means that when you're securing something that's complex, the security requirements are also complex. There are differences between a typical enterprise network and a hospital network. The industry is highly targeted due to the lax in security for most organizations and the high return financially that you can get out of it. There's also a lot of standards and protocols that are unique to healthcare, which introduce security weaknesses. And it's highly regulated as well, which just adds even more complexity. Currently, there aren't that many security related tools that I've come across in healthcare. So looking at a typical enterprise environment, IT departments have only ever really concerned with the things that you'd expect to see, like servers and desktops, laptops, and network devices such as routers and switches, and the other things mentioned on that list. These devices all have fairly well-established support mechanisms. So, for things like security updates and even like network identification. Whereas in a hospital, you've got all these things that you have in an enterprise network, but you've also got medical devices and applications, IoT and patient entertainment systems as well. So because of the huge difference in a number of different types of medical devices you've got, the device identification is a problem too. So there's a common saying with how do you protect what you don't know? And in hospital environments, this can be, more of a case than in most other places. And then once you are able to identify those devices, then keeping track of them can also be difficult, due to possibly the frequency of use of some devices. So, I mean, it's easy to track a server that's on 24/7, but not a medical device that perhaps gets wheeled out every now and again and used briefly and then put away. Additionally to that is the prevalence of legacy devices. So when we're talking about legacy devices, that could be either a device that's no longer supported by the manufacturer, or the company that originally made the devices no longer exists. Our legacy devices exist in other sectors, but more so in hospitals, because a lot of devices are in service for much longer. If you imagine like a corporate laptop is maybe in use on average between 3 and 5 years, whereas some medical devices can be in use for 25 years or maybe even more, depending on what it is that they're doing. Now, there's also financial constraints, but this isn't something that's unique to healthcare industry, but the problems that they face with those financial constraints are arguably more impactful. So decisions need to be made with limited funding, where they need to choose between, say, something that has a positive, tangible effect on someone's life, compared to securing the underlying infrastructure, where it might not be obvious how that is at least directly improving a patient's well-being. So that viewpoint is starting to change, though, as this industry is highly targeted. Back in 2017, WannaCry did a few things. It highlighted how insecure the industry was on a whole. It also showed how patient safety and cybersecurity are linked. It also demonstrated that healthcare organizations can suffer these severe outages and still keep people alive and well. And as even though the NHS was affected quite a lot, we're still seeing a lot of successful ransomware attacks in the US. It's possible that that incident has maybe shifted cyber criminals' boundaries and given them almost like a green light to attack hospitals. I mean, if you've got an organization that is operationally critical and often easy to attack, it's a very tempting target, especially if it's financially lucrative. So, when I mentioned protected health information before, these they're worth more than credit card details. The value of those is ranges pretty wildly from the reports that I've seen. Anything from $15 up to $1,000 per record. And I mean, you can see that this is a health record does contain a lot of information, so it can be used for a lot of different types of fraud cases, not just for falsifying medical requirements for insurance purposes in the US, but in some cases you could even be able to fraudulently acquire passports. So there's, like I mentioned, there's a huge increase in ransomware as well, because there's obviously a need to be operational all the time, and we're seeing a lot of healthcare organizations are paying ransomware just because they don't have alternatives, which is against best practice. And at least in one case as well, there's just a case of extortion where they're not even locking up they still have access to the data. The practice still had access to their data. It was just on threat of releasing that information. There's also, it's not just the sort of hospitals, there's pharmaceutical companies. So the intellectual property and R&D that goes into that is highly valuable too. And then when we think about how it is in the current pandemic, I mean, this is causing additional stress to healthcare professionals, making them more susceptible to things like phishing attacks, which would more than likely lead to easier ransomware deployment. As also the rapid adoption of telehealth, which is being increasingly targeted, as well as raising privacy concerns when unapproved platforms are being used, at least initially. Additionally, with remote care, more devices are being used in people's homes. So you've got more internet medical things outside of hospital networks and on untrusted networks where IT teams have no control over the security measures in place or other devices on the network. Okay. So these are just, there's obviously a lot more than I've listed here, but these are some of the main standards and protocols that you find that unique to healthcare. Got HL7V2, V3, CDA. So these are all clinical messaging standards. HL7 is the organization that developed these. The version 2, which is the most widely used, is first came about in the 80s. As you can expect, there's hardly any security, if any at all. So it doesn't facilitate encryption. It doesn't validate messages. It's also inconsistently implemented. So, one system might not be able to talk to another system, even though they're both using HL7V2, just because of the way it's been implemented on there. So it often gives it the moniker of the non-standard standard. Now, there's the lack of consistency in implementation also leads to additional systems in between. So there are integration engines. These facilitate the communication between medical devices that can't communicate to each other. So there's more complexity there as well, which just adds more potential attack vectors. We've got Daikon, which is Daikon imaging, digital imaging and communications in medicine. So this is, as it says there, medical imaging. There's also a lot of data held in a Daikon file. So again, lots of PHI in there, which is again valuable. A lot of these implementations, again, it's been around for a long time. So a lot of these implementations support clear text. So files can be sent over the network in clear text for anyone to be able to see if they're on that same network. And because of the amount of text fields that is embedded in those files, you can also insert malicious code that can be executed on a system that is viewing those. And then we've got fast healthcare interoperability resources. This is the latest clinical messaging standard developed by HL7. And this is hopefully going to address all the interoperability issues. And there is an element of security in there. However, it doesn't mandate it, but it is using existing technology such as HTTPS to allow it rather than try and do it itself, which is always a good thing. Okay, so here's an example of a HL7V2 message. This is about as technical as it's got to get, by the way. So here you've got a message and each of these lines. So the one start with MHS, EVN, PID, which wraps around to this line here, and NK1, these are all segments. And these are separated by pipe delimiters, which each of these are fields. So as you can see in this made up message that I've created, there's a lot of info in there, a lot of personal info. So you've got name, date of birth, address, email address, next of kin, and any sort of allergies down there. And then with Daikon, so you've got an image here. This is an anonymized image, but up in the top right-hand corner, I don't know if you can see my mouse. That would be where sort of like patient data would be, and then there could be other bits of data in there as well, depending on the viewer. Now, on the left-hand side here, the Daikon tags, these are all the bits of information that are sort of embedded in there. You can see there's quite a lot here, and towards the bottom, there's the patient information that obviously, if it wasn't anonymized, would be full of data. Now there's other things as well. So I've got images of myself. So there's in there there's it's not just all my details, but there's details of the surgeon that ordered the scan. There's the person who operated the device. It's also information on technical information on the device itself, so IP address, what software it's running, what version of software it's running as well, which can all be useful for attacking those systems. Now, this is a section I'll admit is just too huge, really. So this isn't going to be too in depth at all. Basically, the healthcare sector is incredibly regulated. It's huge. There's geographical differences as well. So regulations in the UK are different to in Europe now, and US and Australia, Japan, just to name the ones that are on there. And historically, there's been little or no consideration for cybersecurity in the UK. Devices on the market needed to be safe, and try and mitigate as much of that risk as possible. And where appropriate, and if those risks can't be mitigated, then you just sort of list what's residual. Now, the current regulation, so the Medical Device Regulation 2002, is transposed from European law, which consists of 3 different directives: the Medical Device Directive, Active Implantable Medical Device Directive, and Intravenous Device Directive. And because of Brexit happening, these rules are going to be updated, but they fully come into effect in May this year. But because Brexit happened just before that, the UK is at least diverging away from that and has come up with the Medicines and Medical Device Bill, which is essentially the MDR, but allows the UK to make amendments further down the line. Now, following on from regulations are standards. There are a number of standards that allow medical device manufacturers to be able to conform to the regulatory requirements, such as the ones listed there. So that's ISO 13485, that's quality management systems, ISO 14971, which is application of risk management, medical devices, and then 27001, which is information security management. Now, there's a lot more than there are listed there, like a lot more. But again, these aren't always straightforward. So to help with standards, there is also guidance available to allow manufacturers to follow standards, which then allows them to conform to regulations. And we've got those just listed to you there. The MDCG 2019 is guidance on how to abide by follow the EU regulatory requirements, and then NIST have published a lot of different ones. For example, 1800/24 is to do with PAC systems, so picture archiving communication systems, so like Daikon and that. One worthy thing to note here is that a lot of these organizations, so a lot of these geographies, like particularly FDA in the US, are looking at harmonizing things globally, so that there's a single approach. And one organization, the IMDRF, they've come up with the so that's the International Medical Device Regulators Forum. They came up with the MDSAP, which is the Medical Device Single Auditing Policy, and this is accepted by a few geographies in lieu of the local requirements. So I think Canada and the US are accepting devices that come through the MDSAP program instead of their own ones, which is good. It's good to see. So, as mentioned, I've not really come across many security tools now. As my career as a security consultant, there's a lot of tools available for lots of different types of testing. So, for example, if you're testing a Windows device, there's plenty of tools out there that help you, test those systems. Whereas, there doesn't appear to be, at least in my searches, that many offensive tooling. However, you can still use quite a lot of existing tools, and that the majority of things out there are more focused on monitoring and identification of devices, which makes sense, seeing as that identification is a bit of an issue. It's also probable that it's probably not a good idea to start port scanning devices on a network that could be connected to a patient. So, although pen testing in hospitals is becoming more commonplace, at least in some circumstances, so there is potential there for more development in that area. At NCC, we started sort of doing this with building a test environment using open source software, and the intention is there to emulate a clinical environment so we can safely develop and test tooling capabilities. Okay. Okay, so patient data privacy. Obviously, securing healthcare systems and devices is ultimately about protecting patients and their data. I mentioned earlier the privacy concerns that have arisen due to the rapid adoption of telehealth during the pandemic. However, there are plenty of other areas of concern. So, for example, healthcare apps. These aren't regulated, so if you think about fitness trackers or sleep monitoring apps or anything like that, users can be, putting in and handing over your protected health information without really understanding the privacy implications of these applications that aren't regulated. So for instance, what are these apps do with that data? You've also got, big tech gets involved and the associated sort of public trust that goes with that. Over the years, Amazon has partnered with NHS. You've got Google and Ascension. These are all sort of immediately meted with, what are these big companies doing, and are they going to be able to get hold of my data? And so the public can generally be pretty wary of this, because these companies that of the perceived sort of disregard for people's privacy that they could have, and there's nothing really to say that it's going one way or the other. So balls out on that one. Then wearables and consumer grade technology. It's kind of similar to health apps, really. So things like smart asthma inhalers, ovulation or pregnancy trackers, glucose monitoring, or blood pressure devices. These quite often have like an associated app with them as well. But what are those? How's the data being handled on those devices, and there's the associated apps? Are they being stored and handled safely and securely? Possibly. But again, these devices aren't scrutinized in the same way that medical devices are. So they're not regulated. And I guess some of these sort of do state that when they're advertising that they're not to be considered medical devices, but people obviously still use them for the benefits that they can get out of them. So here's just sort of a list of interesting issues that I've come across as I've been doing my research. So one to do with fitness trackers. This was a company a few years ago that decided to display a heat map of all the publicly available routes that people had uploaded from their fitness tracker. And the thing was that I believe at the time the default set was for routes to be made public. And obviously when they've published this heat map, what was then discovered is that there were a number of locations of secret US Army bases revealed, with sort of detailed layouts of those bases as well. In the University of Washington, some researchers managed to input malicious code into a stretch of DNA. And then they fed that DNA into a sequencing machine. That sequencing machine, when it read the DNA, executed the malicious code, and they were able to compromise the device. Now, these researchers did, they gave themselves the best possible chances, in their own words, there, by disabling some security features and adding a vulnerability into a piece of software. But the proof of concept is still valid. It shows like what would possibly be able to happen in the future, which is pretty interesting. If we then look at general IoT, not necessarily medical IoT, just we're talking sort of lift sensors and things like that, and how they could affect day-to-day running in a hospital environment. So if you think you can disrupt movement throughout the hospital, say, like, let's mention the lift sensors, and people are trying to transport patients to and from maybe surgery and things like that. That's can add complications. And in one case, there was a refrigeration sensor that was open to the public and still used default credentials. So I think it was like admin and the password was 123456. And that allowed, luckily at this point, it was a security researcher that found and reported it. Also, luckily that the refrigeration units were only storing food, but if you can imagine the possibility for, you know, to be blood or vaccinations or anything like that, could be pretty devastating. And then the vaccination data that was stolen, or allegedly stolen recently for Pfizer and BioNTech. This was data that was posted allegedly that came from the European Medicines Agency. And there's also a similar thing with Pfizer, where I think South Korea has alleged that North Korea had attacked. And this sort of, you know, goes back to the whole sort of intellectual property and research for pharmaceuticals. It's big money. Then, sorry, where are you? Daikon images available online. Yeah, so this was a piece of research done by a security company in France, and they'd spent 6 months of trawling the internet, seeing what they could identify with Daikon, and they discovered that they were able to, over the course of the 6 months, they were able to access over 45 million images, you know, without any sort of access. Yeah, this is all done responsibly, and you know, they've helped some of these organizations shore up their security posture. But you know, if you use sort of open source tools to sort of see what's available, you know, there's still quite a lot of Daikon ports showing as available, and a lot of them are using well-known ports that are traditionally for clear text as well, which isn't great. And then third-party libraries and components. So this is specifically talking about when you're, say, a device manufacturer, you're building, you know, you're building your device, and you'll use third-party software components that, so that you're not having to build everything from scratch or code everything from scratch. It's just incredibly common. Now these libraries can be used in billions of devices, which we found out not too long ago with the release of Urgent 11, which was 11 reported vulnerabilities in a third-party component for the TCP/IP stack, which is basically, you know, network addressing. And not long after that, Ripple 20, which is a similar thing where 19 vulnerabilities were found, and then again, not too long ago, Amnesia 33, which, as you can imagine, was 33 vulnerabilities. So we have this thing called SBOM, which is a software bill of materials, which is mandatory in the US through the FDA, which is basically a medical device manufacturer sort of lists all the open source, off-the-shelf commercial third-party software components that are in its device. So, you know, it helps the manufacturer and the end users help track any vulnerabilities that get announced. So you sort of think of it like an ingredients list. And finally, on this one, we've got the secure decommissioning. So when medical devices do sort of reach their end of life or end of use, it's important that these are decommissioned securely and wiped cleanly. So this actually comes from a piece of research NCC did ourselves. Matt Lewis, my colleague, he did a talk on IT vulnerability research yesterday, if anyone caught that. So this was a bit of research that he was involved in, where they were testing a medical device and purchased a secondary one just in case anything went wrong. They bought it from eBay, and when the device arrived, even though I think the reseller had said they'd wiped it, upon powering it up, it was immediate obvious that it hadn't, because the hospital name appeared on there. And one of the other consultants managed to extract the Wi-Fi details out there, so the wireless network name, so the SSID, and also the password. Then using open source tools, they were able to confirm that the Wi-Fi network was still operational according to this tool, and that it actually matched up to where that hospital was located. So what they're demonstrating there, that it's potentially possible to access a hospital Wi-Fi network without actually doing anything other than buying this device, really. So very important that details are wiped off these devices. Okay, so finally, cybersecurity training within healthcare. So it's important to sort of realize that cybersecurity and patient safety are they're inextricably linked. So cybersecurity is a patient safety issue. There was recently a hospital in Germany suffered a ransomware attack, which caused an incoming patient to be referred to a different hospital, which delayed the care. And unfortunately, that patient did end up dying. Now, initially they thought the delay in care was responsible, and then the people responsible for deploying the ransomware were much deeper trouble than they would have been otherwise. But ultimately, an investigation into that determined that it wasn't, because the patient was already in fairly bad health. Now, that's not to say that I would say, okay, cybersecurity issue didn't cause a problem. It really is only a matter of time, and who say that something hasn't already caught it, because there aren't many studies in this area. I've come across two myself, one from Nature, which determined that there were no significant differences in death from the outcome of WannaCry, but there was one conducted by Vanderbilt University that did actually, the aftermath of ransomware and data breaches caused an increase in fatal heart attacks. So, now, as far as training is concerned, should we be thinking about incorporating cybersecurity training in healthcare training? There's an interesting article about a hospital in America where they were going through a simulation whereby the CT scanner was was infected with ransomware, and the important information that was necessary to diagnose or what to do next with this patient wasn't available to the training medical staff. And what was ultimately came out of that was that the patient survived but suffered sort of severe brain damage from it, because they didn't have that data available to them. So with all that in mind, what we need to think about is that policies and processes for patient safety are robust, and clinicians care about them. So if we incorporate some cybersecurity practices into that, you have a better chance of increasing patient safety. And the current likelihood is that organizations will continue to be targeted. But the more research and time we devote to healthcare, will hopefully start to change this around and help give the protection the healthcare sector needs. Yeah, are there any questions? I'll just have a look. I think there's some in the chat. Okay, no questions. In that case, thanks for joining.